It was very much an Apollo 13 type of moment where anything that you could use to solve the problem, you were looking into using to solve the problem. There was a lot of innovation really across the board in terms of how do we get specimens here? How do we collect specimens? Just even at the start, you know, setting up the collection sites across Rochester and the other communities that we serve, you know, across our campuses. That was number one, and just getting how do we get those? How do we innovate around that? How do we move staff around? How do we move equipment around? How do we change our operations to accommodate these new specimens? And then, of course, with the testing itself. The flip side is, it is energizing to think you're part of the solution, to know how important testing was to help with all that we were seeing what was happening with the pandemic. So it really gave a lot of energy to all of us in the profession to really rise to the challenge and make the testing available, develop the tests that were needed. Mayo Clinic had something special in terms of how it uses clinical laboratories to make a diagnosis for a patient, and we wanted to make that available to individuals outside of our campus, as well as have an educational mission around helping the hospitals that we worked with understanding how to best use the clinical laboratories to support patient care. One of the real challenges coming out of the pandemic is the fact that many people have not sought their routine health care and because of COVID. And so we're seeing diseases like cancer, that many people have skipped cancer screening and those things. And so a lot of the work that we're doing in DLMP and in this advanced diagnostics lab is really use testing to provide further insights into individual diseases and to understand how to best manage patients. The clinical laboratory is a very regulated environment, as it should be, because we're producing information that people make decisions about. Sometimes, though, all of that structure can be sort of an inhibitor to sort of the spontaneous thought and creativity that innovation spurs. And so it happens there, the ideas come from there, but if they don't have a place to germinate and to grow, then they tend to not go as far as they could. So that's really what's great about this space. It's ideas coming right out of our clinical practice, right out of the clinical labs that we consider and then bring over to an environment where we can really start to let them flourish.